Welcome to this preview of Exam Communication Mastery. 66% of dog owners leave your hospital without heartworm preventatives, putting patients' health and pharmacy income at risk. I'm Wendy Myers, founder of Communication Solutions for Veterinarians and best known as the Queen of Scripts. Let's talk about 4 strategies to dispense more preventatives during exams from my course on Exam Communication Mastery. Strategy number 1 is to check records for purchase history before starting appointments. The technician or assistant will identify when preventives were last purchased, how many doses were sold, and whether the pet owner may be sharing doses between multiple pets in the same family. Second, I want you to preview services and products at the beginning of appointments. Technicians or assistants will introduce themselves to clients, explain their role, and then identify clients' concerns to help the veterinarian prioritize care and keep appointments on time. So you'll say, "Hello, Brenda and Max. I'm Ashley, the technician who will assist Dr. Jones. Thanks for completing your wellness history form, which I've reviewed, and I will ask you follow-up questions. I will get your pet's vital signs, and then Dr. Jones will join us. Does Max have any health or behavior concerns that you want to discuss with the doctor?" So let's talk about the key words that I highlighted for you here in red. First, I want you to praise the client for completing the history form in advance. This saves you 10 to 15 minutes per exam. Just ask follow-up questions about specific answers. Next, I want you to explain your role of getting the initial history and vital signs so that clients don't have to regurgitate all of these details to the veterinarian. And then lastly, always ask about health and behavior concerns up front. This will let the doctor prioritize a medical problem before we start to look at the wellness services and products that are due today. It also helps you keep appointments on time. Once the client replies, explain services and products that you'll deliver during today's appointment. So I want to talk again about the keywords I've highlighted here in red for you. When you describe services, start with the exam because it is the first and the most important medical service that the doctor will deliver today. Next, explain vaccines based upon your standards of care and risk assessment. Then discuss diagnostic tests such as intestinal parasite screen and a heartworm tick test. And then lastly, lead clients to refill medications, especially preventatives. And I want you to use the action word of needs instead of the wiggle word of recommend. You want to be very clear and confident that preventatives are medically necessary. And then close with, what questions may I answer? Because this invites a discussion and is much more engaging than the phrasing of, do you have questions, which is close-ended yes or no. Third strategy is to have doctors and technicians discuss preventatives in exam rooms. It is not just what you say, it is where you say it. Don't leave conversations about preventatives up to client service representatives at the checkout desk. When clients leave exam rooms, they have mentally checked out and they may dismiss the front desk team's efforts to sell medications. Always offer 12 doses first. This reinforces your standard of care for year-round protection. If clients can't meet the expense of 12 doses, offer 6 today and then help them set up an account in your online pharmacy and auto ship the next refill of 6 doses. If clients can only afford single doses, also set up monthly delivery of single doses of preventatives through your online pharmacy. Now, let's look at the comparison. Heartworm preventative dispensing went from an average of 5.5 doses when sold in clinic to 11 doses when auto shipped. So it's really important we look at what are ways we can dispense more preventatives in exam rooms, and how can we also have proactive compliance efforts by utilizing the tool of our online pharmacy. In Exam Communication Mastery, you're going to get scripts and more strategies to increase compliance for preventive services, products, and procedures. Join me for Exam Communication Mastery, a live stream event on October 9th from noon to 2 o'clock Eastern Time. Now, don't worry if you can't attend the live session because Exam Communication Mastery will be recorded. After the live event, you will get 12-month access to the 2-hour video, handout, quiz, and certificate for 2 hours of continuing education credit. Want an even better deal? Instead of paying for this 2-hour course, upgrade to the All Access Pass and get it free. Our All Access Pass includes more than 100 hours of courses, special live stream events, and our client service community. Enroll at csvetscourses.com or scan the QR code. Let's get more clients to say yes to care. Get started today.